Hello and welcome, and thank you very much for joining us today. My name is Kat and I'm an editor at RM, having previously been a teacher for a number of years. And today I get the absolute pleasure of introducing Dr. Tina Ray for this keynote session. So Dr. Tina Ray has over 35 years experience working with children, adults and families in clinical and educational contexts within local authorities and specialist services. She's currently working as a consultant educational and child psychologist in a range of SEMH and mainstream contexts, and for fostering agencies as a consultant psychologist, supporting foster carers, social workers and looked after children. She was an academic and professional tutor for the Doctorate in Educational and Child Psychology at the University of East London from 2010 to 2016. And she's also a registered member of the Health and Care Professions Council, a member of the European Network for Social and Emotional Competence, and a former trustee of Nurture UK. Tina is a member of the editorial board for the journal Emotional and Behavioural Difficulties and for the International Journal of Nurture and Education. She's also a member of the advisory board for Fresh Start in Education. And not forgetting that Tina is a prolific author and has over 100 publications to date. So I'm very excited for today's session. In this session, Dr. Tina Ray will be focusing on routes to recovery and focusing on the need to connect, soothe and nurture as we return fully to the classroom learning context. Throughout the session, if you do have any specific questions, please do type them into the Q&A box, which should be at the bottom right of your screens, and we'll try to answer as many questions as we can towards the end. So I have been really personally looking forward to this session and hearing from Tina. So enough from me, and I will hand over to you.
Thank you very much. I shall share my screen now. Thank you for that welcome. That was lovely. And hopefully you'll be able to see my presentation. I'm going to focus today on routes to recovery. So I call it flipping the COVID catch-up narrative in order to promote well-being. So hopefully this will be a useful session which will leave you with lots and lots of practical ideas that you can actually use straight away, some of them, but also think about how you're going to further develop your own recovery curriculum. As Catherine said, I was formerly a teacher. I'm currently working as a psychologist and author, and also a therapeutic supervisor. And many of my publications you'll find from Nurture UK and also from my current publisher, Hinton House Publishers. And lots of the tools and strategies I'm going to present today as part of this session are taken directly from these resources. So I'm going to really focus on what I think is the need at the moment to connect, soothe, and nurture our children and young people and our school communities as a whole as we fully return into the classroom learning context. I'm also going to make a case, hopefully, for this rejection of any notion of what I call academic catch-up, kind of shifting the narrative slightly, because what I think we're at risk of today in this current moment in time is pathologizing all our children in terms of all of them having the need to catch up, having lost time academically, and also now subsequently to the final third lockdown in the UK, having serious mental health difficulties. I think it's really, really important we look at this as a continuum of need, recognising those that do need additional support currently, but also recognising the inherent resilience that many of our children, young people and their families have displayed. I'm going to think very much about creating a whole school ethos for recovery, developing and resourcing a recovery curriculum, and recognising the need for rules, resources and rituals that underpin this, that really support and build our mental health and well-being. And hopefully as well, just point the direction to a more hopeful future for all of us in terms of education and how we meet the needs of our children by developing what I would call more flexible, blended learning opportunities and whole school frameworks for mental health. The most comprehensive study, I think, at the moment in terms of actually looking at what's happened to children's mental health during this last year has been the CoSpace Oxford study. So I'm going to give you a couple of slides from this study, and I'm going back to January now and thinking about how mental health systems increased in January subsequent to the new lockdown at that current time. And what this study is continually doing is actually assessing children and young people's mental health using the Strengths and Difficulties questionnaire and noticing the attention, emotional, behavioural needs increasing during this time. Also, in January, subsequent to the new lockdown at that time, there was significantly a proportion of secondary school age girls with emotional problems which had increased significantly. From my own experience working currently with children and young people and liaising with CAMHS services in my area, we know, for example, that eating disorders, particularly amongst girls, have increased, but also 48% of eating disorders have now been actually designated to boys. So I think this is really, really interesting. There's been a slight shift. We know that there's been a 46% increase, but 48% of the referrals made are now boys. So although that still means the majority are girls, there is a significant increase in the number of boys. And obviously as a direct result of the lockdowns and being at home and experiencing heightened levels of anxiety. I think we need to not lose sight of the fact that children have lost a lot in terms of being able to connect with others, in terms of being able to access learning on and socialising with their peers and with their members of staff who are attuned to them. And I think they've missed out on some of those rites of passage. So we did a very small scale study with 4 schools in my area of Kent where I live, and we got some very interesting pieces of feedback. So these are direct quotes from the children and young people who took part in the study. And I think what's important here is I have changed the names obviously for ethical reasons, but just actually, you know, being very clear about noticing I could have done better if I'd had the chance. I feel that there's been so much that's taken away from us. We didn't get to have our end of year prom, missing friends, missing those social contexts, but also conversely to this, children who have actually thrived in lockdown and have actually found the experience of being at home something soothing, nurturing. They've been able to engage with things that they've loved doing. And very much I'm thinking here about children, for example, with autism who have found it much, much easier to access learning at home, who've had more time to go back and revisit the videos and look at the PowerPoints, who've actually not had to cope with what they find a very overstimulating, over-social environment in the school context. And they've not had to contend with bullying issues, with issues of actually falling out with friends, etc. So I think we have to remember this is a continuum of need here. This lost learning narrative really became predominant in February, I think, of this year. And I think that this was primarily due to the feedback from the NFER, which identified the significant learning loss of year 2 pupils aged 6 or 7 due to the school closures. They found that they'd fallen behind with both their basic literacy and numeracy skills. And I also, this Fiscal Studies Institute of Fiscal Studies identified that there would be an average lifetime earning loss for these children of 40k per child as a result of this lost learning. I do have to call into question the way in which this was actually set out and the way in which they analysed this data. So I think we have to be very careful here and be very clear about the impact of this kind of message being fed to our children and their families at this current time, of being this lost generation who are going to lose out on learning, but also financially, and also are going to have such significant mental health problems. I think when we really look at what our education system is about and who it actually provides for at this current time in the UK, we've got to be very, very careful. It's an exam-based peer ranking scheme. As Lakhani says in his amazing Rethinking Education podcast, this is designed to determine who should succeed and who should fail. And what does it really favour? We know it favours the academic child or young person and penalises those who are creative or neurologically diverse. And many children during these lockdown periods, during this pandemic, will have experienced real opportunities to engage in such creative ways And I think this is something that we need to factor into our thinking. They will have gained a body of knowledge and made connections with real world experiences that will impact for some of them very positively throughout their lives, finding things that they're really passionate about, really interested in. And all of this will be unmeasured and unacknowledged or uncelebrated by the system unless we take a different tack here, because this isn't about those predefined boxes that we tick off. And I think these children do not need to be told that they are falling behind. However, from my perspective, the big issue remains that unforgivably 30% of British children live in poverty and without access to resources that many of us take for granted, such as the internet. And I think there is a need now and an opportunity perhaps to consider some more urgent education reform akin to the Education Act in 1944, so that kids have access to the resources that they need, a reliable connection to the digital world, to be fed, safe, supported and believed in. I'm passionate about this. It's from this basic foundation of nurture and nourishment that I think all our children would be able to flourish and really follow their passions, developing these interests and excellence in topics far beyond the current limited national curriculum. So let's think, let's be creative, let's just get outside the box a wee bit and re-envision this, thinking about what would happen if we really internalise that every single child is innately equipped with the curiosity and ability to thrive, and recognise our own roles as the leaders, as the guides, the mentors, the champions of these children and young people. Robert Halfram, MP for Harlow and Chair of the Education Select Committee, was speaking in February 2021 and said, in the past, the mantra has been education, 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 university, university, university. Now, he says, our focus must be on catch up, catch up, catch up, and skills, skills, skills. I really would counter this argument now. I think our focus needs to be on repairing relationships, repairing their self-esteem and confidence, repairing their well-being, building the level of confidence, connecting with them and ensuring that they can connect again with each other and socialized in a way that helps them to gain an ability once again to engage in the curriculum and their learning and build a sense of safety, because it's from a base of safety that a child or young person can maintain a level of self-regulation that enables them to actually academically engage. I think we need to flip the script here, to shift the narrative from this notion of children and young people all as these damaged individuals who have significant mental health needs now, who all need to catch up. Children and young people have shown us during this last year that they can survive, that they have a level of resilience, they can be compassionate towards each other and support each other, that they're flexible, adaptable. They are not this lost generation, and labelling them in this way is not something that is going to be helpful in any respect as we move forwards. We need to build on this and not marinate our children in anxiety. Good news from the Co-Space study, of course, published this month, it's their 10th report in the series, is that children's mental health symptoms have decreased from February to March of this year as lockdown has been eased. So what does this show us? It clearly shows us that actually getting back into a sense of normality, going back into school, being able to connect with others, engaging again with learning, talking about the things that have worked well in lockdown that haven't worked so well, engaging with the fact that I need to recognise what I need to do in order to catch up, as opposed to being told that we all need to catch up academically, is really, really important. As soon as we start to feel safe, engaged, and once again connected in our communities, then those symptoms will and have decreased. So this is a positive thing to really factor into our thinking now. What is not an unexpected outcome currently is that 1 year into the pandemic, children and young people from certain households continue to show elevated mental health symptoms. And we know who these are, those from lower income and those with special educational needs. And sadly, I don't think that this is an unexpected outcome for those of us who work therapeutically or work in educational contexts. And these are the children and young people that we will be factoring into our thinking and our systems for support going forwards. These are the ones that we need to actually make sure we're on top of as soon as we get back into the learning context full time. Because for some of our children, of course, at the top end of the continuum, particularly those who had pre-existing mental health conditions prior to these lockdowns, they will be the children who we will now know will be at risk of what I call emotionally based school avoidance. They will be finding it much harder than others. I would imagine that the majority now of our children, young people, and we know this, of course, from the Co-Space study, will be engaging with the support of really attuned adults, someone they can talk to, with the opportunities to reflect on experiences and engage in a wellbeing mental health recovery curriculum. Most of our kids will be fine. They will manage, they will pull through this, and they will be able to once again re-engage and catch up academically and emotionally. There will be a small but significant proportion of children who may experience real difficulties going back into school and be at risk of non-attendance. And lots of these will be clearly symptoms for us to look out for. So a decline in punctuality, increased levels of anxiety, negative talk about school, and really those atypical behaviours, not quite normal, but being much more distressed on a regular basis. And we know when school avoidance or emotionally based school avoidance starts to happen. It's when there's a transition, normally, usually between primary and secondary. When a child has lost someone, there's been a bereavement within the family or a significant change, parents have divorced, etc. There may have been a change in friendship groups, or there's some bullying going on, or there's been a prolonged absence, very often due to ill health. So if you look at that, those criteria, it's really obvious, isn't it, that of course COVID-19, all of these triggers can be associated with the pandemic. I don't actually need to further illustrate them. We can therefore predict, I think, that there will be more pupils, more young people and their families who will be struggling with this issue. The impact of COVID-19 has been to exacerbate, I think, for some of our children, levels of anxiety in terms of separation, social anxiety, more generalised anxiety and health anxiety. Thinking about, for example, OCD, many of our children who have OCD will have really been struggling with actually maintaining routines so that they don't obsessively go into hand washing, etc., for example. Now, that will have become something they've now been encouraged to do. So it's converse to what they've been actually asked to do in terms of actually their therapeutic intervention. So there will be an impact for some that will have been incredibly negative. So recognising and supporting that level of anxiety, understanding what anxiety is due to social isolation, lockdown and COVID overall is really, really vital. But recognising it is also a continuum. And most of our children and young people won't be at the top end, but for those that are, we really need to be on top of this. We need to reject, in my view, this pathologizing narrative that all our children will now have that level of anxiety, but really be very clear to make sure that we are equipped to support those that do. Many years ago, when I was working with a young woman, I asked her how her anxiety felt, what it was like, how she experienced it. And she described it as being like a brick wall straight in front of her. She couldn't get over it. She couldn't get round it. It was like this big thing blocking her right in front of her. She could not cope with it. It was awful. It felt so dark there behind that brick wall. When I asked her what that would look like, if she could perhaps just manage one little bit of that, it wasn't quite so bad. She actually said it would be like a staircase. That brick wall would be converted into something very, very small steps going upwards. So she could see a way out and over the anxiety. And I think this is very, very important at this current time. If we're going to support children to move on one side of the bridge where they are feeling highly anxious to the other side of the bridge and walk across, where they can manage it, where they can cope with it, it doesn't just disappear, but they can cope with it, then we need to really understand anxiety and how it works. And we need to help them shift from a state of what Martin Seligman calls learned helplessness to a state where they can effectively self-manage. Understanding anxiety here is crucial. What we should never ever be doing now is actually penalising or really, I think, punishing children, I suppose, in a pejorative way, for displays of anxiety. And the problem is that if you don't understand how anxiety displays itself in terms of anger, possible defiance, a lack of focus, concentration, poor working memory, for example, is key here. So that sense of cognitive overload where you actually just can't remember what you've been asked to do. It can look like defiance. Very, very important that we understand that, and we really don't punish children for displaying symptoms of anxiety and trauma. What can we do to start with? From my perspective, we can all focus on what we can control and not on what we can't control. Very, very important. I know for all of us, my behaviour, the hand washing, wearing face masks, social distancing at the moment, being kind, limiting social media, asking for help, staying in touch with people that I love, etc. These can all help me actually really focus on what I can control and actually move away from the things that I can't, and stop myself from worrying about them. We can do an awful lot at this current time to support children in terms of reducing anxiety. And there are 8 keys that I would present to you today here. One is that we can provide them with structure and routine that makes us feel safe. Children, young people who are anxious, and even those who are not anxious, actually all need time to exercise, engage in play and free time. That social time together, just running wild, running free, having quality time where we're doing stuff that has no bearing on our levels of anxiety. So those flow moments, those moments when we're enjoying just being with other people, when we're doing something creative, sporting, etc. Limiting access to the news we know, very, very important. We don't need that narrative all the time in the back of our heads. Reflecting and focusing on positives, identifying 3 good things every day, etc. I'm going to talk about this later in the presentation, but maintaining those relationships and also looking after ourselves. As adults in these relationships, it is absolutely vital, I'm going to keep coming back to this fact, that we maintain our own mental health and well-being and foster it using tools of self-care that really are appropriate to each of us. Really vital, because we know that adults who are not regulated, who are dysregulated, who are really stressed, cannot support children who are equally stressed because they have not got that sense of calm they can share. So really, really important. What do we do if we notice a child is feeling or being anxious? We listen, we empathise, and we validate. We never, ever just dismiss a child's concerns, because what might seem like a little worry, a wee worry to us, may be something very, very important to that child. So we listen, we empathise. I know, I can see how you're feeling. That must be so difficult. And we validate. Yep, it's okay. That's normal to feel like that. We label that emotion with them. We help them to do that. We normalise it. This is what most people would feel. And then we help them by teaching them specific breathing techniques, maybe mindfulness activities, and we help them to challenge some of those negative automatic thoughts that they may be engaging in, that have got them into this kind of vicious cycle that really increases levels of anxiety. And the rest of this presentation, I am going to actually be presenting you with some of those key tools and strategies. What do we say? What is it? What is it? Our language really matters, our language and our tone, when we are trying to support children with anxiety. So initially, we need to make them feel safe. I'm here for you. I'm staying here. You're going to be okay. Then it's about recognizing the physiology here. This is going to pass. Your body's responding in an anxious way. Just give it a minute or two. It will go. It will pass. You've been through it before. You can do it again. Then we validate. It's validation. It must be so hard for you. I get it. I'm sorry it's making you feel nervous. It sounds really difficult. Do you want to talk it through? It's not silly you feel like this. It really does matter. I can see you're worried. How can I help you right now? So ultimately, our task is to create and resource what I call a recovery curriculum. It needs to be trauma-informed, understanding anxiety and trauma, how that manifests itself, and what we need to do in order to create trauma-informed, sensitive classrooms. It needs to be nurturing, and it needs to put the well-being of every individual, not just the children, but the adults in the school community first. The wonderful Dr. Chris Small identified how we could create what he called the trauma-informed classroom by creating a safe base. And there are 6 keys to this: ensuring that our children feel a sense of belonging. And we do that by that nurturing, that welcome as they come in, ensuring that they feel safe again, reaffirming the fact that we are together, being predictable in terms of the routines, organising it clearly so that children know what to expect, teaching self-regulation, differentiating in the right way for each individual child. Remember the continuum of need, not everyone needs the same catch-up, but also ensuring that relationships really are pivotal here, that they are nurturing and kind and empathic. So I would suggest that there is a need for all of us to engage in what I call the 3 trauma recovery approaches: self-regulating for well-being, getting moving mentally and physically for well-being, and connecting for well-being. Self-regulation, identifying and modulating emotions, how we control our impulses, delay gratification, how we can make thoughtful, conscious choices and set realistic goals to achieve them. Now, as I said earlier, what's really important is that we, the adults, model this. If we are not self-regulated ourselves, there is no way in which we can support children who are unregulated to become self-regulated. There are 5 ways that we can regulate ourselves. Is it simple? Well, it takes practice, in my view. Breathing deeply, very, very simple. So obvious in essence. All of this is obvious in my view. Like most psychology, it's practical, it's user-friendly, it should be shared. Breathing deeply. We take these short, shallow breaths when we are unregulated. Let's breathe more deeply. Drink more water. Our nervous systems are far more sensitive when we're dehydrated. Pausing. Just taking that moment in the day just to stop, pause, hand on heart, just practicing it, stopping. And thinking, sometimes when we are engaged with a child who is anxious and they are displaying what might look like defiant behaviours, it's really important we recall what we love about the child or young person, or visualise a successful experience we've had with them, because that releases those positive neurotransmitters which balance out the negative brain chemicals produced by the frustration and stress we may experience. We can all self-regulate our own nervous systems. We can. So important. Seeing that positive outcome in our minds, practicing visualization is a hugely powerful and effective tool. We mustn't underestimate that. These are very simple, basic ways that we can self-regulate for ourselves, but we need to teach our children how to do this. We need to be able to model it and share these skills with them. The next slides are taken directly from my publication for Hinton House, A Toolbox of Wellbeing, and from the Recovery Toolbox of Wellbeing. You'll find all of these strategies. Key, simple strategies to support our young children, how to actually gain that sense of self-regulation so they can make their own calm down jar. It's very, very simple strategy: whisking glue that melts together, mixing it with the water, adding glitter, etc., etc. And what you do is you allow them to actually shake that when they are feeling a level of frustration and need to calm. Okay, so very, very simple. The 5, 4, 3, 2, 1 grounding method. So working backwards from 5, using your senses to list those things that you notice around you. So you might start by listing 5 things you can hear, 4 you can see, 3 you can touch from where you're sitting, 2 you can smell, 1 thing you can taste. Just that simple sense of just noticing things, stopping to notice, and that gets you grounded. Visualization, again, directly from the Toolbox of Wellbeing. Imagine yourself leaving those painful feelings behind. You picture yourself gathering the emotions, scrunching them up, putting them into a box, walking, swimming, biking, or jogging away from painful feelings. Just simple ways, visualizing just activities to leave behind those painful feelings. Moving mentally and physically for well-being. Again, a key one of those 3 trauma recovery strategies. Really important that we learn how to challenge our negative thinking patterns. We look for the evidence against them because our thoughts are not always facts. We very often get it wrong. I might think that I'm the most stupid person in the class. I might think that I'm one without any friends at all. But actually, if I challenge that thought and I look for the evidence against it, I might find that my thought is not particularly accurate. Also, getting moving physically for well-being. We know those feel-good chemicals in the brain that are the result of physical activity, those endorphins are really what we need. They're well-being essentials. So I teach children key tools and strategies from cognitive behaviour therapy approaches. You do not need to be a therapist to do this. You just need to learn how to recognise when you're engaging in thinking errors and challenge yourself. Very simple. When you're doing yourself down, when you are catastrophising, blowing it out of proportion. If you're predicting failure, so, setting your mind ready to predict failure, whatever is happening. If you're being over emotional or setting yourself too high targets, which many of us do if we're anxious, rather than the small steps to success, or you blame yourself, recognising these errors is vital. And engaging physically, again, that physical agility, along with the mental agility of challenging negative automatic thoughts. Outdoors relieves stress and anxiety. We know this. It tops up on our vitamin D, okay, it releases serotonin. This helps regulate our emotion and mood. It's linked to greater levels of happiness. I don't need to go into the research. There's so much out there. We know that this is a given. But if we need to worry, and we do sometimes, it's also important to acknowledge that. I do not think that for 1 minute as a positive psychologist, life is all about being happy all the time. We need to shift away from that very simplistic notion. But I do think we are capable of more happiness on a daily basis than we currently experience, many of us. And this is to do with actually managing it effectively. And I don't think there's anything wrong with just having that bit of time to worry. Sometimes a child will come in from school, they might be worried. Let's sit down 5 or 10 minutes. Let's designate special worry time. I'm going to sit and worry about this, and I'm going to write maybe these things out on post-it notes, but then I'm going to go out and play. I'm going to have some physical time outside. I'm going to go for a walk. I'm going to do something creative or go on my laptop and play games so that I can actually come back to those worries later and talk them through with my special adult. And also, I think this notion of facing my fears using the anxiety ladder, another key tool, a strategy that I use with all of my children who are anxious. We draw out a ladder. We put the fear at the top of the ladder. Maybe you can have 5 steps, 4 steps, 10 steps. And we put at the top of the ladder the most feared thing, the thing that I'm worried about, okay? And at the bottom, we put the least feared aspect of that particular problem. Really, really important. And then just step by step, each step on that rung, we write down a small step that we can take to overcome that fear or meet that challenge. Okay, so over time, what is it doing? It's building up good evidence that it's okay to be with the feared object. Fears are not there forever. We can do something about them. Act. Many ways of managing emotions, boosting well-being and self-esteem. These can be placed under 3 headings: active ones, calming ones, and thinking ones. Again, this is a tool from the toolbox of well-being. So those can be running, swimming, singing, mindfulness, relaxation. Thinking ones, challenging negative thoughts. What I ask children to do is keep an act diary for a week, working out what they do under each of those 3 headings in order to maintain their well-being and increase their levels of self-esteem. What works well? Connecting for well-being is also important. Human beings were meant to connect. This is why this last year has been so hard for so many of us. I think me personally, I've missed being connected to my friends. I've missed seeing them more than anything else in the whole world. And I've realised a great deal what really matters to me, and that is those human connections. Humans were designed to actually connect together. So very, very important. It has a contagious effect. Recognising and building those connections and remembering them through happy memories is really, really important. Very, very important that we maintain our well-being by actually thinking back to things that really were lovely in the past, happy times we had together, so that when things are tough, we can actually look back and think about those. You might do a happy memories box or books with your child or young person to actually then pull that out when you're feeling a wee bit down or anxious, and then reflecting on the fact that these were lovely things that happened before and they can happen again. Also, 3 kind acts. I practice this every day. I do live and breathe this stuff. I'm a positive psychologist. It works for me, and it works for many of our children and young people. Rather than going to bed on the negatives, we think about positives at the end of the day. 3 good things, but also 3 kind acts I can do the next day to support other people. They don't have to be huge things. Keeping a diary to record that and reflect on it at the end of every week can be really, really powerful, reinforcing the positives and shifting the focus away from me, to other people and what I can do to support those in my community. I also think it's important to highlight the fact that social media is not all negative. There's an awful lot of stuff out there, particularly in terms of some of the self-harm websites and some of the propensities I think our young people have to focus on their body image that have been very, very tricky and continue to raise huge concerns. But during this pandemic, I have to say I've come across lovely groups of young people, particularly in their teenage years, who have been sharing things on social media to help and support each other, creating WhatsApp kind messages groups. What will they post and share to support each other? Hugely positive. The need is there. It's paramount for us all to understand trauma and anxiety and what works. I presented you there with some very simple tools and strategies for self-regulation, for actually recovery, underpinning a recovery curriculum, but understanding trauma, anxiety, understanding therapeutic approaches, how they can be adapted by non-specialists and used in the classroom context is really important. I'll point you to the Wellbeing Toolkit for Mental Health Leads, because this has a really, really comprehensive 20-session program that would support you in developing your skill set here. The 3 R's are what I'm talking about in terms of maintaining wellbeing: routines, resources, rituals, and rules. Every single one of us, adult and child alike, needs a healthy mind platter, a balance between sleep, physical time, focus time, connecting, play, downtime, and time in where we really focus. So please don't forget that this should be the focus for all of us in terms of developing our own toolbox of well-being. Those routines, linking in the magic moments during the day, flow activities which are creative or physical or active, art activities that reduce screen time, time just to chillax, time when we engage in physical exercise, absolutely essential. The rituals of engaging in mindful moments, self-soothing, that grounding that I talked about, the 5-4-3-2-1 method, visualization, also essential on a daily basis, not just for the children, but for us as the adults supporting them. So the 3 A's of anxiety, accessibility, and attunement are what really should be underpinning our approach currently in terms of recovery and flipping this current catch-up narrative. We need to understand and recognise anxiety and the need to support all along that whole continuum. We need to make sure that everything's accessible, both the support that children need, the catch-up, the mental health support, but also thinking forward, the accessibility in terms of how children learn and where they learn. And attunement. We all need a level of attunement to others within our school communities. Every one of our children, young people now possibly need some form of personal anxiety support plan, or you may call it a COVID transition plan. But I think this is also, you could just simply call it a well-being plan if you don't want to over-pathologise. I think it's really, really important that children and young people develop their own plans, that they know what works for them in terms of maintaining mental health and well-being. Writing down what works for them, being really specific about this when things are making them feel anxious, and then being flexible, being able to change and adapt their approaches. But we have to ensure that they have access to a recovery, mental health, well-being curriculum that really helps them choose what works for them. Thinking about this, a framework for it, they need to identify their triggers. What makes it worse? What helps? When is it not so bad? What 3 things that they could do straight away to calm themselves? What small steps could they take? And this is really, really important. The first minute when you feel anxious is the minute at which you can make all the difference in terms of utilising your tools for self-regulation. And also things I can do every day to look after my well-being. So activity scheduling, factoring in things that are pleasurable on a daily basis, people I can go to for help, and any websites, helplines or text lines that they may find helpful. And it's really important that one of those at least is available 24/7, because children, young people, particularly adolescents, you'll never know when they may need the help. They need someone to talk to straight away. Ultimately, I'm talking about building a toolbox for well-being. And all of the things that I talked about in terms of worried time, calm down jar, cognitive restructuring, etc., the visualization, really, really essential. But what's important to remember is that one size doesn't fit all. Some of our children will need limited access to this stuff. Others will need far more. But every one of our children deserves the opportunity to access a wellbeing curriculum, which incorporates all of this. And then they can choose for themselves what works for them, what helps them on a daily basis, and make use of that. It's what they put in their own toolbox. I'm just going to highlight journaling, however, as one key element of this particular way of supporting children's well-being. Really, really important. As I said, it's their own toolbox. And I think it's important. If it doesn't nourish you and yours, don't do it. If it doesn't work for you, don't do it. Try and find out what does. I find journaling a really useful form of keeping my well-being and maintaining it on a regular daily basis. It provides me with a structure and ritual around that, and thinking about what went well that day, 3 things that I really enjoyed, but also problem solving and planning for the next day. How can I manage any anxieties that I have? So I think it's a really, really useful thing to focus on. Why? Recovery through journaling, it can improve our mental health and well-being because it helps us record and savor special moments, so it highlights the positives. It can help us manage or reduce our stress levels because we can think about what went wrong and problem solve. It can improve our confidence and self-esteem because we highlight the good factors, the things that did go well. It can help us to build our social connections and support us in processing problems, negative feelings or experiences, and that is helpful. Okay, if you think about Gibbs' learning cycle, I think that's probably an important one to think about, actually reflecting on our learning, what we've learned that day, what went well, what didn't go so well, what I was actually thinking and feeling at the time, what I might do differently next time if I was encountering the same problem or difficulty. So journaling can be incredibly powerful. Attunement, my third A, really, really important. Just to highlight this, no significant learning takes place without a significant relationship. And this is why I'm saying recovery through nurture, soothing relationships, absolutely essential. There is a need now for the authentic, connected, therapeutic adult within our school communities. And please don't think that means you have to be a therapist. It just means that you need to behave in a more therapeutic way and respond more therapeutically. And we can all learn how to do that. Helping children and helping ourselves too to process and understand traumas. We can actually learn how to engage in therapeutic story writing. We can build the child's narrative with them and build their capacity to use emotional language. And this is really important because all of this stuff, all of it, comes before the ability to self-regulate. And if we want self-regulated children, they need access to these authentic, connected, therapeutic adults. I found out today that the new £17 million that the government are proposing for mental health leads in schools, so that every school has access to this 2-day training for September, is going ahead. And I just want to say that I do find this complex and difficult because I think that actually it takes a lot more than 2 days training. So I do need to highlight that with you. And I think it really does matter that people in our schools do feel secure and trained up enough to actually take on this role of the authentic, connected, therapeutic adult. We need to nurture our empathic brain if we're going to do this. I think we need to nurture our empathic brain as parents, carers, psychologists, teachers, TAs, whatever our role is in the school community, if we're going to effectively support our children, young people to self-regulate. So we need to look at our own physical needs and engage in the kind of self-care that ensures our well-being, regular opportunities to engage in relaxation activities, that we sleep well, that we eat healthily, that we make sure that we nurture our intellectual needs, our thinking and learning, ideas and stimulation, that we have the right kind of support emotionally, practically, and also that we're in touch with our own feelings. We can express them and talk about them. Really vital. So keeping yourself well is essential. We can only teach, parent or support when we're regulated. So if you do one thing as a result of this session this morning, please go away and think about what you do and what you have currently in terms of supporting your own physical, intellectual, emotional and support needs. Essential, because going forwards, we are pivotal in terms of supporting our children's mental health and well-being and helping them to engage in the curriculum. And at a whole school level, we need to be thinking also about how we do that in terms of ensuring relational safety. We must not have any of this COVID nastiness, I call it, where people are demonising those members of the staff team who find it harder, or over pathologizing in any sense, or suggesting that some people need more support than others in a derogatory way. They may do. Let's be really calm about this. Let's connect with them. Let's support each other. Let's share a sense of hope and a sense that we can actually be in this together and we can get through this. And that is really important, that we don't demonize those who have more significant issues and have had a harder time this last year than some of us have had. So in the whole school right now, we need to be focusing on those things that we can control, both for ourselves as a staff team, but also for the children and young people. We need to continually think about our strengths and moving on those, using those to actually meet the challenges that we currently have and connect as a community. And if we're thinking about the staff team per se, because it's essential that their well-being has got to come first. They cannot support the children and young people in this. This is paramount, and this is a priority. Having that collective self-care space for 20 minutes where we share our skills, strengths and ideas, only the positives, okay? So we don't sit there and moan about things. We don't sit there and focus on everything that's gone wrong. We share the skills that we have. We share the strengths. We support each other. That self-care space can be really powerful. It's a simple tool when we don't have the opportunities or the money or the financial resources to really access additional support. And for many of our schools, sadly, that is the case currently. For the whole school now, in the future, think about our wellbeing systems, how we screen for wellbeing, what we're doing, what is effective, how we really ensure that we're meeting the needs of those at the top end of the continuum who really do need both an emotional and cognitive catch-up. What are we doing in terms of staff wellbeing and supporting individuals and the whole team? Have we got the kind of bespoke therapeutic interventions that some of our children will need? Are we training those key members of staff and building what I call in-house capacity? It's a big ask, but I think we really need to be focusing on this as a priority. Those key attuned adults in schools are the ones who really will be able to help our children, not specialists from outside of the school that they have no connection with. And also thinking about how we're developing flexible blending learning options, which will include access and inclusion for all. My real COVID catch-up plan, you can download this if you follow me on Twitter. And also if you go to my YouTube channel, where I have, I think, near enough about 40 plus free CPD sessions, and one of them goes through this COVID catch-up plan, and it's a lovely thing to share with your staff team, but it also reinforces my key messages today and highlights the key points that I've made in this presentation. So just actually flagging that up for you as a free downloadable resource. So to summarize here, I think we need to reject this notion of a lost generation. We've got to be very clear. We know who has been negatively impacted the most from the co-space study, Oxford University, those with special educational needs and those from those poorer communities. But we've got to be clear about this. Safety and nurture now comes first before academic catch-up. Children will begin to catch up much faster and more easily if staff and children all feel regulated, safe and secure. And we really focus on addressing anxiety issues. We make things accessible and we ensure a level of attunement here. Let's think about how we ensure this sense of community and connection. We help children, young people and adults in the school community to develop their own skill set in terms of managing anxiety and developing their own wellbeing plans so that they can self-regulate, developing their own toolboxes. We need to look after ourselves first as adults, crucial, and continue to develop in-house capacity for mental health support / catch-up. And developing flexible blended learning opportunities is really something I think we need to factor into our thinking. When you consider some of our children with mental health difficulties and specific needs who really have thrived in lockdown, what worked? And for some of our children, young people, think about maybe more flexible blended approaches in the future. Some of us will not be returning to the office full time. And that's great because this is working better for many of us in terms of mental health. We need to perhaps just think a bit more creatively and really focus on the creativity inherent in each child and adult and get a bit more creative so that real recovery can happen. We've got a chance here, in my view, to flip the narrative. So really important. Let's do it. thank you very much for listening. And I hope that there's been some useful ideas and strategies that you can take from this presentation this morning. And please do follow me on Twitter, and please do access the free resources on my YouTube channel, and hopefully make reference to some of the resources I presented today. So thanks very much, and I shall go back now to the main screen.
Brilliant. Thank you so much, Tina. So many ideas, so many practical strategies and resources that teachers can just take away and implement straight away. And I can see Anne's commented that similar echoing message in the chat box. So thank you very much. So we are now moving into the Q&A part. So we'll answer some of the questions that have come in. If you do have any questions for Tina, please do put them in the Q&A box, and we'll try and get through as many as we can. I can see people already saying that they'd love to follow up on this in more detail with you, Tina. So that's brilliant. So one of the first questions to start off with is around, I suppose it sort of rang true, the supporting the staff with their well-being and their mental health. As you said, you know, we can't support the young people in the settings unless we've supported the staff. So what would be your kind of advice to leaders, school leaders around that?
I think there's something about, you know, you've got to have that regular daily checkup. And I think every single member of staff has got to have the opportunity to talk about their issues. So when people talk about the business meeting, the staff meeting, the team meeting, there also has to be a focus on well-being. And it mustn't be things that are trite. Sorry, like, for example, let's all do a bit of yoga on Thursday after school, because quite frankly, I want to get home. I'm tired. And quite frankly, what really would reduce my levels of stress and anxiety as a teacher is to have someone really considering my workload, how I'm working, how that can be more accessible, how that can be formalized in a way that actually takes pressure off. A lot of my colleagues who were teachers have said they were in the first lockdown fully online teaching, and they had absolutely heightened levels of stress through the roof because they didn't have the opportunity to record things and present them. And I think there has to be a balance. And I think my biggest piece of advice is create the right kind of balance, because there are ways that you can still continue to do your job and do it well without having to be full on all the time. And I think also, please, 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 at this moment in time, remember everyone is slower. We are not processing in the same way. Our working memory is not as good. You know, when you've experienced heightened levels of anxiety and you've been worried and you're tired, you are not functioning in the same way. So can we please cut people a bit of slack? And can we please, please, please support our staff to actually maintain their well-being, to make sure that, you know, when they are in school, that they feel safe, they feel considered. And I think that is something about a mindset too, and giving that message. And if it comes from the top, if it comes from SLT, that really can reduce anxiety incredibly quickly, particularly when it's genuine, dare I say it.
Yeah, I think people can tell, can't they, if it's coming from the right place or not. And then thank you for that. In terms of, you know, young people who've got specific special educational needs, you know, we've sort of talked, how do you adapt, change, tweak things for children who maybe are coming in and they have a diagnosis of autism or ADHD or anything? How would you suggest schools tackle that?
I think there has to be an acknowledgement. For example, it's, you know, there is something about the transition period now, and lots of children, young people that I've met have said that they are incredibly anxious. These are the ones with autism in particular, about going back into the school because they're worried about other people, their peers, being in that social context, which they find really difficult. They are super sensitive in terms of the noise, etc. And they've not had that experience for so many weeks, so many months. And I think there is something about the level of differentiation has to change now. If I've got a child with anxiety, for example, if I've got a child who is frightened of the water in the swimming lesson, I would never chuck them into that swimming pool, because they won't swim, they'll drown, they'll struggle, they'll drown, they will be a real issue there. You just wouldn't do it. And I think we have to maybe be a bit more nuanced now, a bit more empathetic and a bit more patient and considered about the strategies we use getting kids back in. And it needs to be a much more small stepped approach. And for some of our children, young people, that when I talk about blended, when I talk about a more nuanced approach, some of them just can't come straight back in. So what are we going to do? We have to be much more nuanced about it. And I don't think that's easy, but I think at the same time, if you try and push people too fast, then you're actually going to get this big block and children will stop and they will refuse to go into school. So you want to actually just really do a very careful set of planning with the inclusion manager, with the SENCO, with those supporting the child to make sure that it is really bespoke to that young person. I'm only talking about the top end of the continuum here. For most of our children, young people, they will be going back into school. I've watched kids here this morning skipping in to the local primary school. They are so happy to be back. And you talk to most parents and, they're fine. They've eased in. However, some of them have eased in seemingly for the first couple of weeks, and then the bits of anxiety begin to show. So I think, it's about being vigilant. But I think for our special needs kids, we maybe need to be tweaking this a bit more and making it a bit more part-time in terms of actual time in school. And I think that, many of our parents would be happy with that because they can see that it would work. And ultimately, you want them all back in full-time. We want them all accessing the curriculum full-time.
Definitely. Brilliant. And those children, I mean, some of the teachers that I've sort of spoken to recently, they're saying that it's the children that have kind of been attending school that have they've seen the heightened anxiety because they've been in a small group, they've had one of them meal, they've been able to sort of monitor their own learning. And as you say, the small groups can work for a lot of children. Is there anything sort of different or specific for those children that are finding it hard that now their whole class is back in?
Yeah, I think there's something about recreating the sense of a community together and celebrating what they learn, sharing that with the other kids who've come back in, having this kind of two-way thing so that you begin again to say, look at us, look at what we were before as a class together. Because I think there is a sense of loss that they're experiencing. So I think there's something about, with some of the younger kids at our local primary school, they created a lovely little memory book of what it was like being in school in their bubble. And that was lovely because it reaffirmed that for you, it reaffirmed that for them and how special that all was. But then thinking about what it was like before that and what worked well and what we liked about being together as a bigger group. And so I think it's about reinforcing that. And it will take a little bit of time to adjust. They've been kingpins in a way and they've been used to having a huge amount of attention. And I do think there's something, I'm not tongue in cheek here, but I think there's something really special that it shows us about how big our school classes are and how lovely it is when children actually do get that more individualized attention and approach because the staff have had time to do it. But, notwithstanding that, this is what my local primary school did, and it did seem to work.
Brilliant. I think we've probably got time for one more. We had one around the sort of staff confidence. So I know you said, you don't have to be a therapist to sort of use different approaches. How would you suggest schools build staff's confidence in tackling some of these? For some children, it's quite a challenging discussion to have around, how would you build that for them?
I think this is all about CPD. It's all about training. And when I made reference to the mental health leads in schools, and obviously they're going to get this 2-day training and support to actually support staff themselves to gain knowledge and skills. I'm not sure from my perspective, I don't think personally that's adequate. I think that, you actually do need regular input on this particular area. Now, that doesn't actually have to cost you a fortune. Okay, this is really, really important. If you look on my YouTube for example, I've got sessions on anxiety, school phobia, how to use tools from CBT. If you make reference to the wellbeing toolkit from Hinton House Publishers, again, 20 sessions of CPD that someone could be actually delivering to their staff team if they had a wee bit of time to actually look through that, and maybe some support from their educational psychologist. You do not need to be a therapist. What you need to do is learn about how to use things like mindfulness, learn about how to challenge negative automatic thinking, how to recognize it. That is not being a therapist. That is actually being more therapeutic. And these, for me, are life well-being skills. But, you know, all staff need access to training in those particular areas, in my view. So actually engaging in that way is really, really important. But I think it is vital that, you know, I'm not asking people to deliver therapy to children who have anxiety disorder. What I'm saying in this presentation is that all of us can become better at preventing lower levels of anxiety from getting worse. And we can all be empathic. We can engage in those attuned, supportive conversations with kids. I've heard someone walking down a corridor with the child after some training that I did with them. And I heard her saying, do you know what? I think you're catastrophizing there. I think you've blown that out of proportion. What do you think? Do you think that's really true? How true is that you've just told me? Because actually, I think this and this and this. I've seen you do that, so I know that that's not quite true about you. You can do that well. So that's a therapeutic conversation itself, walking up the corridor. And that's what I'm talking about, okay? You do not need to be a therapist to do that. But if you are the designated mental health lead or the inclusion manager of the SENCO, if you are the safeguarding lead and you are responsible for supporting children, for example, who are known self-harmers, etc., then you do need more support yourself, and you would need access, in my view, to clinical supervision. And I think that's a different call. But for most of us, what I'm talking about in this presentation is developing a skill set, and it can be done through good quality CPD.
Brilliant. That's great. Unfortunately, we have completely run out of time, but I'm sure all of us could sit here and talk about this area and talk to you all day. But so thank you so much, Tina. That's just, you know, for me, so many useful strategies to use in my own working day now that I'm not in schools. But so thank you very much. So thank you everybody for attending. Within 24 to 48 hours of this session, you will receive your attendee pack, which will contain a recording of this session, so you can watch it back and revisit the slides, your certificate of attendance, and also a short survey. If we can ask you to take a moment to complete that survey, the results do help us to plan for future events, plan for future information that we do share with you, and make sure that they're topical for you in the future. So do stick around for the next session that's coming up at 11, which is about leaving no learner behind and utilising technology to support all learners. And in that session, you'll hear from Forest Federation on their transformation of ICT and the effects that this has had on teaching, learning and work-life balance. You will also have full access to all of the content on demand for 3 months after this event. So thank you very much for attending. Thank you very much for presenting, Dr. Tina Ray, and hopefully we'll all see you at another session. Thanks very much.
Cheers. Bye-bye.
Bye.